Good morning, students. Today is the first day of public health posting, and your first lecture will be on Introduction to Public Health and Evolution of Public Health. Learning outcomes for this lecture will be at the end of this session, the students should be able to define public health and its scope, list the core functions of public health, describe the difference between medical care and public health. Describe the evolution of public health. First, the definition of public health. Public health is defined by CEA Winslow in 1920. It is the science and the art of preventing disease, prolonging life, promoting physical health and efficiency through organized community efforts. Community efforts are very important. Through organized community efforts for the sanitation of the environment, control of community infections, education of the individual in principles of personal hygiene, the organization of medical and nursing service for the early diagnosis and preventive treatment of disease, and the development of a social machinery which will ensure every individual in the community a standard of living adequate for the maintenance of health. So the key components in the definition: public health is the science and art of preventing disease, prolonging life, promoting physical health and efficiency through organized community efforts for the following functions: sanitation of the environment, control of community infections, education of the individual in principles of personal hygiene, organization of medical and nursing services for the early diagnosis and preventive treatment of disease, and the development of a social machinery which will ensure to every individual in the community a standard of living adequate for the maintenance of health. Now the scope of public health. Scope of public health includes preventing disease, prolonging life, promoting physical health and efficiency. Preventing disease. There are three levels of prevention: primary, secondary, and a tertiary level of prevention. Primary prevention is prevention of disease before the occurrence of disease. In the pre-pathogenesis phase. Secondary prevention is the prevention of disease during early pathogenesis phase, that is by early diagnosis and treatment. Tertiary prevention is preventing the complications of disease at the late pathogenesis phase. It is by disability limitation and rehabilitation. Second scope of public health is by prolonging life. How we can prolong life? By early diagnosis and a prompt treatment of illness. Third scope is promoting physical health and efficiency using health promotion activities. Okay, now we can go through 14 core functions of public health given by Oxford Textbook of Global Public Health. First core function is prevent disease and its progression and injuries by primary prevention, secondary prevention, and tertiary prevention. Primary prevention before the occurrence of disease in the pre-pathogenesis phase. Secondary prevention during the early pathogenesis phase, early diagnosis and treatment. Tertiary prevention to prevent disabilities and for rehabilitation. Second core function is promote healthy lifestyles and good health habits. It's a part of health promotion, promoting healthy lifestyles and good habits. Third core function is identify, measure, monitor, and anticipate community health needs, as in times of epidemic and pandemic. Identify, measure, monitor, and anticipate community health needs. It is known as surveillance. Fourth core function is investigate and diagnose health problems, including microbial and chemical hazards. Various health problems we need to investigate and diagnose. That's also a core function of public health. Fifth core function is formulate, promote, and enforce health policies, essential health policies. We need to formulate some health policies, promote health policies, and enforce health policies. As in time of pandemic, we have to formulate some health policies in the community, promote it and enforce it. Make sure that it is followed by the people. Then organize and ensure high quality, cost effective public health and healthcare services. So that's also a core function of public health. Organize and ensure high quality but cost effective based on the resources available in the country and state. It should be effective also. So cost effective public health and healthcare services. Then reduce health disparities and ensure access to healthcare for all. There should not be any disparities, health disparities or health inequalities. Okay, all people from both gender, all socio-economic class, all religion, all races should get equal access to healthcare. Then next is promote and protect a healthy environment. Okay, environment is having a great role in health. So one function of public health is to promote and protect a healthy environment. Then disseminate health information and health education materials should be disseminated and mobilize communities to take appropriate action, to mobilize and motivate communities to take appropriate action. Then plan and prepare for natural and man-made disasters. That is one core function of public health. Planning and preparation for natural and man-made disasters, including epidemics and pandemics as we see now. Reduce the impact of interpersonal violence, domestic violence, and war and conflicts. Reduce the impact of that. That's also one core function of public health. Next is the research and development. Conduct research and evaluate health promoting and disease preventing strategies. We need to evaluate the effectiveness of various health promoting strategies, disease prevention strategies, and we need to conduct more research on that. That is a core function. Develop new methodologies for research and evaluation. There are different methodologies. Descriptive research. We are describing about a health condition. Analytical research. We are comparing the outcome in one group of people with another group of people. Comparing health outcome in one population with another population. Third is experimental research. Experimental research means we are evaluating the effectiveness of a intervention or treatment. One group of patients will get one type of treatment. Another group of patients will get another type of treatment. We are checking which treatment is more effective. That's a experimental methodology, experimental research. Community-based trials. One community will get one intervention. Another community will get another intervention. And we are checking which intervention is better. Then another methodology, systematic review. We can collect data from multiple published studies and check which intervention is better, which methodology is better. Okay. Train and ensure a competent public health workforce. That is also one core function of public health. We have to train and ensure a competent public health workforce so that they can be very confident and competent at the time of an epidemic or a disaster or some crisis situation. Now we can see how public health is important to medical care. Public health includes various subspecialties like epidemiology, biostatistics. Epidemiology is the core discipline of public health. It helps to understand the causes of disease, the risk factors of disease, and the distribution of disease. What are the causes of a disease? What are the risk factors of a disease? How the disease is distributed in terms of time, place, and a person. Where it is more located, where the disease happening more, who is affected more, and when is the time, when it started, when it is more. Understood? Without knowledge in biostatistics and epidemiology, no physician can independently and sensibly interpret the medical literature. Have you heard of the term evidence-based medicine? Evidence-based medicine means it is looking for the latest available evidence or research evidence and apply that evidence in our clinical practice. So before applying the evidence, we have to know if the evidence or research is of good quality or not. Physician need to interpret the research evidence or literature before he is applying it to individual patient or community. So knowledge of biostatistics and epidemiology is very important to critically evaluate the research article before applying to the clinical or public health practice. Public health teaches influence of various factors like environmental factors, nutritional factors, social factors, behavioral factors on health, illness, recovery, and wellness. Okay, public health teaches the influence of environmental factor, nutritional factor, social, and behavioral factors on health, illness, recovery, and wellness. Physician who appreciates the role and potential for public health interventions has a deeper understanding of the conditions that preserve health and prevent disease. Okay, many of the diseases can be prevented and health can be promoted by various public health interventions. So physician should know about the public health interventions also so that his patients will be more healthier and uh, they can avoid diseases in patients. Okay. Public health interventions are also taught under the, okay. Public health emphasizes cultural sensitivity. What is cultural sensitivity? Similarities and differences in values, morals, and practices in different cultures. Different cultures have different values, different morals, and different practices. So, public health helps to understand the cultural sensitivity, community engagement. Some communities are more social and more helpful, more intelligent, more educated. Okay. And health literacy. If you are taking Japanese community, their health literacy is very high, and their approach and attitude towards public health is better, which have a direct bearing on the ability of patients to participate in their own health care and to protect their family's health. Some cultures and some communities will have more compassion and empathy to the community. So, those people will perform better in prevention of disease and in families' health. Public health exposes physicians to exciting and more fulfilling career opportunities. There are a lot of career opportunities in public health, like in global health, disaster response, health policy development, environmental health, occupational health, epidemiology, research, general preventive medicine. Okay, so many fulfilling career opportunities are there. Many of the international agencies recruit people who are specialized in public health, in global health, disaster response, health policy development, and all. Okay, now we will go through the differences between medical care and public health. Medical care. Medical care is the care given to an individual patient. Okay, primary focus is on an individual patient. But public health focus on the health of the population, health of the community. So primary focus is on population or community. So I told you before, medical care focuses on an individual patient, right? So it emphasizes on diagnosis and treatment and care for the whole patient. The same time, public health emphasizes on prevention, health promotion for the whole community because it's focusing on community, right? So prevention of disease and health promotion, it is focusing. Third one, medical care emphasize on medical care of patients. Okay, that's already told, medical care of patient. But public health emphasize on so many activities, so many interventions. Okay, along with medical care of patients. Okay, what are the interventions public health aims at? Environmental intervention, behavioral intervention, and a lifestyle intervention. Environmental, behavioral, and a lifestyle intervention. Along with that, medical care of patient also. So environmental intervention, behavioral intervention, lifestyle intervention, along with that, medical care of patient. Then fourth component, social sciences form an elective part of medical education. In medical care, social components are not studied much or not focused much. Medical care mainly focus on the patient care. Okay, not looking for social factors. So social sciences are just an elective part. If a treating doctor like to know about social factor, he can read sociology and social factors affecting health. But in public health, social sciences form an integral part of public health education. So social factors, socio-economic factors, and behavioral factors, behavioral science is also a part of public health. So please keep in mind. Then, fifth one, biologic sciences are central in medical care. In medical care, biologic sciences are central, stimulated by symptoms and needs of patients. Patient's symptoms, patient's clinical manifestation, and patient's need are the stimulus. Okay, it moves between bedside care and a laboratory. Bedside care is there, laboratory care is there. So, laboratory tests are done, followed by bedside care. That's the main focus of medical care, stimulated by symptoms and needs of patient. Okay. But in public health is stimulated by major threat to the health of population or community's health is affected. That's a major threat to health of populations or community. That is a stimulus for public health. And it moves between laboratory tests followed by field or community activities. First is laboratory test followed by field and community activities or field or community interventions. Okay, medical care. Clinical sciences form an essential part of professional training in medical care. All of us know clinical sciences, clinical specialties form an essential part of medical care. Specialized care is needed in medical care, right? In public health, clinical sciences are desirable to professional training in public health. Clinical sciences are desirable only. More focus will be on factors affecting health in the community like social factor, environmental factor, lifestyle factor, behavioral factor. Okay, and how to do community interventions to control the disease in the community. Okay, so along with that, medical care is also there, but more importance to social, environmental, behavioral, and lifestyle factors. Rooted mainly in private sector, medical care is rooted mainly in private sector. All of us know private sector more focused on profit, right? So medical care is given mainly by private sector and private sector is more attracted to it because of the profit from that. Public public health rooted mainly in public sector, community intervention, community based research and community based activities, identification of social and economic and environmental factors. All these are of interest of public sector. So public sector or government sector will get will be focusing more on public health activities. Now we can see about the specialization of medical care. Lines of specialization of medical care are organized by organ systems like cardiology, neurology, gastroenterology, urology, hepatology, endocrinology. All these are by organ system, right? Then by patient group, obstetrics for women of reproductive age group, gynecology for women, pediatrics for children, geriatrics for elderly, okay, like that, patient groups. Etiology and pathophysiology like infectious diseases, non-communicable diseases, oncology, or diabetes specialists, okay, like that. So specialization based on etiology and pathophysiology or by technical skills like radiology based on the technical skills, surgery by technical skills, Now, for the specialization of public health. Public health lines of specialization are organized by analytical methods, epidemiology, identification of risk factors and causes in the community, toxicology, identification of the toxic principles or poisons, poison level in water, food, or air, setting and population, occupational health, health of occupational groups, international health, okay, international health or global health for different countries of the worldwide health problems, substantive health problem like environmental health, focusing on the health problems related to environmental issues, nutrition, okay, health problems related to nutritional factors. Now we can go to the second part of our lecture. It's evolution of public health. We will go through various theories of modern era of medicine related to development of disease. One theory is miasmic theory. Based on that, toxic vapor or miasma emanated from decaying animal or vegetable matter are diffused into the surrounding and spread all sort of disease. Okay, a toxic vapor or miasma. It is coming out of decaying animal or vegetable matter, diffuses into the surrounding and causes disease. That's the miasmic theory of disease. Second theory is contagion theory or germ theory. This theory held that epidemics or diseases resulted from transmission of germs or contagion. Third is the spontaneous generation theory or abiogenesis. Okay, was originally propounded by Aristotle, who believed that living organisms directly emerged from non-living organisms. So, spontaneous generation, abiogenesis, living organism directly emerged from non-living organism. Later, the theory was displaced by theory of biogenesis. What is theory of biogenesis? You know, life originates from life. That is by Louis Pasteur. Okay, in evolution of public health, in 14th century, there were so many deaths related to plague, and quarantine was first introduced at that time. Quarantine. All of you know what is quarantine is. If somebody is exposed to a risk factor, exposed to a person having disease or symptoms, and currently don't have the symptoms, will be isolated for a period of maximum incubation period. Okay, and we will check if they are developing the symptom or not. Okay, apparently healthy individuals who are exposed to some deceased individuals will be isolated for a period of maximum incubation period. Okay, European doctors visiting plague victims. Okay, you saw the picture. They wore protective clothing, mask, and a beak also, containing strong smelling herbs to protect them and to prevent transmission from patient to health workers. Okay. In 1716 to 1794, there was one great physician, James Lind. Okay. He was a surgeon in Navy ship. Okay. He found out that many of the sailors were developing bleeding disorders from gums and they were dying during sailing. Okay, in ships. Okay, he has done an experimental trial to study the effectiveness of various diet on scurvy. And he found out that group of sailors who were getting citrus fruits were found better. Okay, or the bleeding manifestation was less and death was less among those who were getting citrus fruits. And he published that experimental trial in a treatise of this scurvy in 1757. Okay, and that was the first experimental trial or experimental epidemiological study done. Okay, then in the evolution of public health, there was so many deaths reported due to smallpox in 1700s. Okay, Edward Jenner, he did an experiment in 1796. Okay, he used vaccination using cowpox virus against smallpox. Okay, what was what was the stimulating thing that made him think about cowpox? Oh, smallpox related death and smallpox was lower among milkmaids who were in constant contact with cows. So he suspected if cowpox virus can give an immunity to those exposed to smallpox. Those get exposed to smallpox. So he carried out first vaccination with cowpox virus in 1796. That was Edward Jenner. Okay. In 18th century, preventive medicine evolved. Okay. Developed as a branch of medicine distinct from public health. Preventive medicine got a firm foundation after discovery of causative agents of disease and the establishment of germ theory of disease. So, based on Louis Pasteur's uh, germ theory of disease, preventive medicine got so much backup, and it evolved as a part of public health. Okay, in 1800s there was a outbreak of cholera in London, and so many people got affected due to cholera and died because of cholera. And there was a doctor, John Snow, who was an anesthetist, and he suspected the link between cholera cases and particular water source, that was Broad Street pump. He made a spot map of London city marking all the cases of cholera and found that most of the cases and most of the deaths were around a particular water source, Broad Street pump. Based on uh, his recommendation, the pump handle was removed and that Broad Street pump was locked. After that, number of cases reduced, number of cases of cholera and the number of deaths due to cholera reduced. Then also there was some doubt. Some cases were reported away from Broad Street Pump. Okay. Then they inquired about the source of water among them. They told they were staying near to Broad Street Pump for many years, and even after going back, because of the taste of water of Broad Street Pump, they were attracted to come to Broad Street Pump and collect water from that. That made them ill, and many of them died also. So John Snow's this hypothesis related to the relationship between Broad Street pump with cholera was based on the spot map and based on the history taking, epidemiological history taking. So that was the birth of applied epidemiology. And John Snow is considered as the father of modern epidemiology. There is one website by UCLA. UCLA is University California, Los Angeles. They are having one specific website on John Snow. Rise of public health. Okay. Great cholera epidemic of 1832 led to the birth of public health in England around 1940. That time only John Snow was there. John Snow studied the epidemiology of cholera in London from 1848 to 1854, and he established the role of polluted drinking water in the spread. Okay. Then, based on the recommendations, there was a Public Health Act of 1848 was enacted in England. That was the rise of. There was a sanitary awakening in England and London. Okay, a milestone in the history of public health is the Great Sanitary Awakening. Okay, it was in mid 19th century, gradually spread to other countries. The same time there was an industrial revolution also. Industrial revolution means so many industries started in urban areas, creation of slums, overcrowding with all its ill effects appeared in England. Okay. Now next in the evolution of public health is about Florence Nightingale. Okay. It's That century, 19th century saw the rise of nursing as a profession. Okay, till that time nursing was not very much appreciated. Nursing was not given much care. Florence Nightingale believed that infection arose spontaneously in dirty and poorly ventilated places. Okay, so she focused on improvement of hygiene and healthier living and working environments. Okay, and Florence Nightingale also advised and supported the development of a district nursing in Liverpool. Okay, now we will see the upliftment of bacteriology. Robert Koch. Robert Koch is a German scientist, was one of the founders of bacteriology. In the process of discovering the causes of anthrax, cholera, and tuberculosis, okay, he developed methods and technical procedures used by epidemiologists. Okay, he discovered the causes of anthrax, cholera, and tuberculosis in 1882 to 1883. Do you remember? In 1840s itself, John Snow identified the relationship between cholera with drinking water using a spot map. But in 1882-83, the causative organism of cholera was discovered by Robert Koch. Okay, there are some criteria developed proposed by Koch as Koch postulates. And Robert Koch was awarded the Nobel Prize for Physiology in 1905. What are the Koch postulates? You should know. That is, microorganisms must be found in abundance in all organisms suffering from the disease, but should not be found in healthy organisms. If a virus is a causative organism of a disease, means those with that disease should have virus in his body. Microorganisms must be found in abundance in all organisms suffering from the disease, and microorganisms should not be found in healthy individuals. Okay, that's the first postulate. Second one, microorganism must be isolated from a diseased organism and grown in pure culture. If a person is diseased, we should be able to identify, isolate the microorganism and grow in pure culture. Okay. Third one, cultured microorganism. What we culture it should cause disease when introduced to a healthy individual. Okay, when we are introducing the cultured microorganism to a healthy person, it should be able to produce the disease. Microorganism must be re-isolated from the inoculated disease experimental host and identified as being identical to the original specific causative agent. So these are the Koch postulate. He was able to prove it in most of the diseases that organism was found in abundance in those with the disease. Then he was able to isolate the organism and grow in pure culture. After that, cultured organism was able to produce disease in a healthy individual. From that individual, he was again able to culture the organism and it was similar to the previous organism. So that's a coach. Then about Louis Pasteur. Okay, Louis Pasteur, already we told about the germ theory of disease, right? It's a French microbiologist, Louis Pasteur, conducted experiments that supported germ theory of disease. Okay, he developed he developed um, the vaccine. Okay, first vaccine for rabies, and he invented the process of pasteurization. Pasteurization is a process of uh, this making milk free of causative organism, free of microorganism. He invented the process of pasteurization. Okay, have you seen UHT milk? UHT milk is has undergone a method of pasteurization known as ultra high temperature pasteurization. Milk is heated up to high temperature of 125 degrees Celsius. Then it is cooled suddenly. So that all the microorganisms are uh, destroyed. Okay. Next is about Ronald Rose. Sir Ronald Rose studied about malaria in India. Okay. He worked on malaria in Calcutta. Okay, Presidency General Hospital. He demonstrated that malaria is transmitted from infected birds to healthy ones by the bite of a mosquito. Okay, and a finding that suggested the disease mode of transmission to humans. Okay, till that time nobody knew that through mosquito bites we can get infection. Okay, in 1902, Ronald Rose was awarded the Nobel Prize in Physiology and Medicine for his remarkable work. Okay, next in the evolution of public health is about Mary Mallon. Mary Mallon is otherwise known as Typhoid Mary. Okay, in 1907, okay, Mary Mallon was identified as the first healthy carrier of typhoid. Okay, she was a chef and she was transmitting typhoid infection to many people through her dishes, and many people got disease and many died. Then only public health authorities identified Mary Mallon as a healthy carrier who was transmitting infection to others. Okay, her case exemplified the confrontation of public health, law, ethics, and the media and anti-immigrant attitudes. So public health authorities suggested her to be at quarantine in a place and do some other job. But Typhoid Mary disagreed to do any other job. So they were forced to put her in a prison, and she died in prison because of pneumonia, not due to typhoid. Penicillin. That's also an evolution of public health. Alexander Fleming, who was a Scottish physician, discovered penicillin while studying fungus molds. Discovery is one of the most important discoveries of 20th century. It can kill bacteria and fight infectious diseases. Okay, this was one advertisement given. Penicillin cures gonorrhea. Okay, now under the evolution, okay, Center for Disease Control and Prevention was established in Atlanta, Georgia in 1946. World Health Organization was established by United Nations on April 7th, 1948. Water fluoridation began in 1948. Deficiency of fluoride can cause dental caries. Okay, so to prevent dental caries, they started water fluoridation. Polio vaccine is another important milestone in evolution of public health. Okay, Salk and Sabin. Okay, Jonas Salk and Albert Sabin developed polio vaccine in 1954. First mass inoculation of children against polio began in Pennsylvania in 1954. Okay. Sabin is a great man. He refused to patent his vaccine, waiving every commercial exploitation by pharmaceutical industries so that the low price would guarantee more extensive spread of the treatment. Another revolution is the use of contraceptive pill. Okay. Shell receives FDA approval to sell Innovid. Innovid is a birth control pill. Okay. First pharmaceutical company to sell an oral contraceptive pill. That was in 1960. Now we can go through the changing concepts in public health. Disease control phase, health promotion phase, social engineering phase, and health for all phase. Disease control phase was from 1880 to 1920. At that time only various vaccination and antibiotic and all were discovered. 1920 to 1960 was health promotional phase, how we can promote our health and prevent disease. Social engineering phase was from 1960 to 1980 to improving the social engineering facilities to reduce disease transmission. Health for all phase is from 1981 to 2000 AD. Now also we are following health for all phase. Health for all phase, there is a health gap between rich and poor, within and between countries. Okay, so that made World Health Organization and World Health Assembly to think about health for all. Include provision of health care to all by reducing the inequalities within and between the population. So individual will lead a socially and economically productive life. Primary care is the tool for health for all. What is primary care? Primary health care is the essential health care based on practical, scientifically sound, and socially acceptable methods and technology. Essential healthcare based on practical, scientifically sound, and socially acceptable methods and technology made universally accessible to individual. It should be accessible to all people, right? And families in the community through their full participation and at a cost that community and country can afford to maintain at every stage of their development in the spirit of self-determination. So that's the definition of primary healthcare. It's a essential healthcare based on practical, scientifically sound and acceptable methods and technology made universally accessible to individuals through their full participation and at a cost community and country can afford. Okay, these are the main components of primary healthcare. First is education about health problems and how to prevent and control them. It's very easy, right? Education about health problems and how to control and prevent it. Promotion of food supply and nutrition. Nutrition is very important. Then adequate supply of safe water and sanitation. All of us know safe water and sanitation is very important. Then maternal and child health care including family planning. That also under primary health care. Immunization against infectious diseases. Prevention and control of endemic diseases. Endemic diseases means whatever diseases are most common in a locality. That is endemic disease. Appropriate treatment of common diseases and injuries and a provision of essential drugs. These are the 8 components of primary healthcare: education, promotion of food supply and nutrition, adequate safe water and basic sanitation, maternal and child health care including family planning, immunization, prevention and control of endemic diseases, treatment of common diseases and injuries, provision of essential drugs. Okay, these are the 4 principles of primary healthcare. Equitable distribution. Okay, healthcare should be available to all, irrespective of ability to pay, gender, social class, or ethnicity. It should be equally distributed. Community participation, involvement of community. That's very important. Then only we can improve the healthcare facilities. Intersectorial coordination. So different sectors are there. Health sector, education sector, or social development sector. All these sectors should work together. Then use of appropriate technology. What is that? Okay, one example is given: ORS over IV fluids for dehydration. If a person is mildly dehydrated, we can give oral rehydration solution. So that's an appropriate technology. We can reduce the burden on hospitals. We can give at home oral rehydration solution at home. We can control the dehydration. These are about the evolution of public health. Thank you.